For my presentation, I chose to talk about human trafficking. In this PowerPoint, I will be talking about the types and forms of human trafficking, the root causes and contributing factors, the impact on a victim's physical and mental health, and the legal frameworks and international efforts. What is human trafficking? Human trafficking is a modern form of slavery where individuals are taken with the purpose of exploiting them through forced labor, sexual exploitation, and organ trafficking. Human trafficking is a tragic and devastating reality that must be confronted and addressed. It is a dark and pervasive crime that impacts people from all backgrounds, both in the United States and around the world. It is a global issue that affects millions of individuals. 27.6 million victims were trapped in forced labor in 2021. 17.3 million were exploited in the private sector, and 6.3 million were forced in commercial sexual exploitation. Traffickers could be complete strangers, people we know, or even family members. Human trafficking is a horrible crime, but also a violation of human rights and leaves forever lasting physical and emotional scars on its victims. Human trafficking is a horrible crime, but also a violation of human rights and leaves forever lasting physical and emotional scars on its victims. Physically, victims of human trafficking may suffer from injuries, malnutrition, and sexual abuse. Emotionally, victims may experience trauma, anxiety, depression, and a loss of trust in others. In recent years, there have been an increasing acknowledgement of urgent needs to address the issues and protect the rights and dignity of those who fall victims of human trafficking. Human trafficking is a crime that is increasing globally, and it can impact anyone, regardless of their background or location. Children go missing every day. There are 80,000 missing children each year. However, certain groups face a higher risk of becoming victims. These include runaway or homeless youth, migrant workers, undocumented immigrants, racial and ethnic minorities, and individuals struggling with substance abuse. Sadly, millions of women and children and men fall victim to this crime every day. An estimated 71% of enslaved victims are women and girls, while men and boys account for 29%. There are many types and forms of human trafficking. Human trafficking and modern-day slavery are both terms that describe the terrible exploitation of individuals through force, deception, and other means. There are various types of human trafficking that exist globally. When someone is forced, deceived, or coerced into performing work or engaging in commercial sex, they become victims of human trafficking. It can happen to anyone regardless of their background. Traffickers often target vulnerable individuals who are living in unsafe conditions and seeking a better life. These victims are lured with false promises and trap them in exploitative situations with little or no pay. Places such as agriculture jobs, factories, strip clubs, or as domestic servants, federal law recognizes these individuals as trafficking victims. One form of human trafficking is sex trafficking. It is when someone is recruited, harbored, transported, or obtained for commercial sex through force, fraud, coercion, or if the victim is under 18 years old. It is a worldwide issue with millions of people being sexually exploited every day. Sex trafficking is rapidly expanding across the globe. It ranks second to drug dealing and is growing at an alarming rate. Victims, often women and children, are forced into various forms of commercial sexual activities against their will. Traffickers employ tactics of intimidation by threatening their victims of providing false information about potentially deportation or arrest if victims of human trafficking were to cooperate with law enforcement. In the case of survivors of sex trafficking, it is common for them to experience apprehensive regarding their safety, well-being, and harbor concerns about the criminal justice, legal procedure, and the availability of social services. Victims of sex trafficking may be subjected to physical and sexual abuse, psychological manipulation, and extreme violence. It occurs in various settings, including brothels, massage parlors, strip clubs, and online platforms. Sex trafficking operates on the principles of supply and demand. When people purchase commercial sex, a demand is created that traffickers exploit for profit. It is crucial for buyers to understand their role in fueling this demand. By choosing not to engage in the commercial sex industry, individuals can collectively decrease the demand for sex trafficking. Labor trafficking is another type of human trafficking where individuals are forced to work through coercion, deception, or threats. It encompasses various forms such as debt, bondage, forced labor, and child labor. Labor traffickers employ tactics like violence and lies to exploit people and make them work against their will in different industries. Farm workers are subjected to violence during crop harvesting. Individuals who are trafficked to work in inhumane conditions receive little or even no pay at all. It is shocking to think about how many consumer goods and food products, both important to the United States and produced domestically, are made by victims of human trafficking. Labor traffickers use various tactics to recruit and enslave their victims. One such tactic is a manipulation of victims' aspirations for better life, often referred to as the American dream. Typically, victims are recruited from their home country, and it is common for both the victim and the trafficker to share the same nationality. Victims often learn about these job opportunities through social networks, unaware of the true nature of the job. Instead of the promised legitimate work with good pay, fair treatment, and extended stay in the U.S., victims find themselves forced into grueling farm work, enduring deplorable living conditions, and sometimes having their documents confiscated. Sometimes it may not be realized, but forced labor can be part of the supply chain of products we often buy. When it comes to labor trafficking, consumer-like companies and consumers and individuals who use services play a role in creating demand and profit for traffickers. If people support fair pay and choose to buy products made by workers who are treated fairly, it can help decrease the demand for labor trafficking. Another type of human trafficking that is often overlooked is organ trafficking. It is when people sell organs for money or advertise them on an online platform and are willing to buy or sell organs. According to estimates, corneas can be worth around 30,000 US dollars, lungs around 150,000, hearts around 130, livers around 98,000, and kidneys around 62,000. Some patients resort to these illegal means and pay for organ transplants, even if it means exploiting vulnerable individuals. Organ trafficking is not as prevalent as labor or sex trafficking because it requires specialized medical knowledge. However, tracking the extent is challenging as it often occurs outside medical settings. The most traded organs are the kidneys, along with the livers or corneas. Other organs are traded as well, but not as common as human eggs, skin, embryos, and blood plasma. In some countries with less regulations, transplants often occur, allowing traffickers to establish criminal networks involving corrupt professionals such as law enforcement and medical staff. Human trafficking has become highly profitable due to the ability to repeatedly sell victims over and over again. Anyone can be a victim of trafficking: children, teenagers, women, college students, homeless, and individuals whom are particularly vulnerable. Along with domestic violence victims, those who have been in foster care are also at risk. Traffickers control their victims through tactics like trauma bonding, exploiting socioeconomic vulnerabilities, and establishing complex relationships based on false comfort and abuse. Human trafficking has two primary root causes: the demand and the supply for it, along with the influence of globalization. Factors such as poverty, oppression, limited rights, lack of opportunities, conflict, and political instability contribute to this issue. Poverty and economic inequality create vulnerable conditions where individuals are more likely to be lured into trafficking. Demand refers to the desire for exploitative labor or services that violate the human rights of the individuals providing those services. Demand is what fuels human trafficking, and addressing this demand is crucial. Evidence suggests that there are three levels of demand: employer demand, such as employers, owners, managers; consumer demand, such as clients in the sex industry, corporate buyers in manufacturing, household members in domestic work; and third parties involved in trafficking process which such as recruiters, agents, or transporters. Without demand for these services, there would be no market for human trafficking victims. In 2006, Las Vegas was estimated to generate between 1 and 6 billion per year through legal and illegal activities related to the sex industry. Traffickers move these victims to markets with the help of others in various ways. As the demand increases, traffickers have to supply more victims. In this market, buyers see the victims as objects to be used and discarded. The number of women and children in the sex industry is what fuels this criminal trade, and it has to increase to meet the growing demand for sexual services worldwide. There are various ways to address the demand of human trafficking. Educating and raising awareness about the harmful effects of sexual exploitation is one way. By reducing the commercial sex trade and the associated crimes is by focusing on targeting sex buyers. It is crucial to prioritize shrinking consumer-level demand, which means addressing sex buying behavior. When people stop purchasing sex, traffickers do not have a market to exploit. Simply arresting traffickers will not solve the problem, as others will step in to fill the void. Educating people about the realities of human trafficking and impact is important. This can be done through campaigns, workshops, and community events. Advocating for stronger laws that target the demand side of human trafficking. This includes criminalizing the purchase of sex and imposing stricter penalties on offenders. By making these steps, we can make a significant impact in ending the demand for human trafficking and protecting those who are most vulnerable. Now I will be talking about the impact on human trafficking victims' physical health. Survivors of trafficking often face numerous physical health challenges, making it a public health and healthcare concern. People who have been trafficked often suffer from infections, malnutrition, dental problems, untreated diseases, and physical scars. Sex trafficking survivors may often experience STIs, HIV, AIDS, pelvic pain, rectal trauma, urinary problems, unwanted pregnancies, multiple abortions, and infertility due to untreated infections. Victims of human trafficking often lack access to preventative health care, leading to untreated health issues that worsen over time. Labor trafficking victims experience distinct yet equally severe health problems. In forced labor cases, victims endure extensive work hours and unsafe conditions such as inadequate training, exposure to hazardous chemicals, and a lack of protective gear. They may also face financial and physical repercussions, including sexual assault, leading to injuries and illnesses. Due to limited control over working conditions, they are at high risk of health damage. Sex trafficking victims, if sexually transmitted infections are left untreated, can have severe long-term effects on health, such as ectopic pregnancy, infertility, and an increased risk of needing a hysterectomy. Women who are trafficked for sex often face forced abortion, which can lead to health risks such as incomplete abortion, infections, hemorrhaging, and injury. These abortions are often performed in unsanitary conditions by unqualified individuals, resulting in further health complications. While women and reproductive health is often discussed, trafficked women also report other physical symptoms like neurological, cardiovascular, and dermatological issues. Research indicates that individuals who have been trafficked often come into contact with medical providers with labor and sexual exploitation. However, survivors face numerous challenges when it comes to assessing quality medical care and services. These challenges encompass language and cultural barriers, stigma and discrimination, safety concerns, lack of involvement in decision-making, and insufficient information or training for healthcare providers. Victims may also try to avoid detection by healthcare workers out of fear of their trafficker or law enforcement. Some victims may fear being judged by medical providers and worry about confidentiality breaches. It is crucial for health facilities to actively work towards reducing these barriers and identifying patients who may be experiencing human trafficking. Now I will be talking about the impact of human trafficking victims' mental health. Human trafficking, including forced labor and sex trafficking, leads to significant health consequences due to limited access to medical care and abusive treatment. The physical and psychological control tactics used by traffickers have lasting impact on the victim's mental health. Experiencing traffic can have severe mental health effects like anxiety, depression, PTSD, substance abuse, and eating disorder. These victims maintain a heightened sense of vigilance due to the perceived ongoing danger they face. Victims of human trafficking have to be alert to dangers such as physical abuse, sexual exploitation, forced labor, psychological manipulation, and even threats to their loved ones. It is a constant battle for their safety and well-being. Victims may experience chronic pain, hearing problems, respiratory issues, vision problems, and infectious diseases due to hazardous working conditions in crowded environments. The emotional suffering they experience is a painful aftermath of the trafficking experience. Trafficked individuals often endure multiple trauma as their trafficking experience compounds with pre-existing trauma they may have already faced. Victims who have been sex trafficked face elevated levels of fear, isolation, trauma, and mental health needs. They experience high rates of physical and sexual violence, memory loss, STIs, and traumatic brain injuries. Victims experiencing trauma while being trafficked can worsen mental health and also make individuals more vulnerable to trafficking. People who have been trafficked may not be familiar with how mental health services work or the available treatment for them. It is important for care professionals to explain care plans to these victims and give them all the available resources they need. Many trafficked victims experience mental health problems and need support to recover. Mental health professionals play a crucial role in responding to trafficking by raising awareness, receiving training, and safely identifying and referring survivors to appropriate cases. Legislation against human trafficking in the United States has evolved over time. The 13th Amendment in the U.S. Constitution passed in 1965, prohibiting slavery and involuntary servitude. Since then, Congress has passed comprehensive bills to combat human trafficking, bringing the full power of the federal government to address this issue. One bill, the Trafficking Victims Protection Act of 2000, strengthened the U.S. government's efforts to prevent human trafficking in several ways. It established international initiatives to improve economic opportunities for potential victims, created the Office to Monitor and Combat Trafficking in Persons, and required the President to establish an interagency task force to monitor and combat trafficking. These measures aim to deter trafficking, engaging foreign governments, evaluate progress in prevention, protection, and prevent prosecution. Another bill, that's called the Trafficking Victims Protection Reauthorization Act of 2005. This bill gave the U.S. jurisdiction over trafficking offenses committed abroad by government employees. It also provided grants for assisting trafficking victims. They funded law enforcement efforts to combat trafficking. There are many other protection acts, but one that protects victims of labor trafficking is the Frederick Douglass Trafficking Victims Prevention and Protection Reauthorization Act of 2018. This act made changes to address forced labor. It expanded the prohibition of labor trafficking in diplomatic households and increased reporting obligations for goods produced through forced labor. The act also established a work group to reduce demand and included police, and other security forces, and the Child Soldiers Prevention Act. Despite the fact that there are laws and efforts in place to fight human trafficking, there are still several challenges and limitations that persist. Some of the key challenges are underreporting and identification. One major challenge is that many cases of human trafficking go unreported. It can be difficult to identify victims. Victims often fear the consequences of coming forward and many do not realize that they are being trafficked, making it tough for law enforcement and service providers to assist them. Lack of resources, complex cases, demand for exploitation, limited focus on prevention, and limited accountability for businesses are key challenges. The U.S. has put in place strong laws, programs, and services to support victims and prevent human trafficking. However, there are still significant challenges and limitations that need to be addressed. It is evident that human trafficking is a worldwide issue that demands urgent attention. Throughout the paper, the research focused on the problems and devastating consequences of human trafficking on its victims. It is crucial for governments, organizations, and individuals to come together and apply thorough approaches to combat human trafficking. In my paper, I learned about the different forms of human trafficking, the factors that contribute to its prevalence, and the efforts being made to combat it globally. By raising awareness and addressing the root causes, we can make major progress. Fighting for justice, standing against exploitation, and striving for a future without human trafficking is an important cause. There are numerous possibilities to make a lasting impact in the fight against human trafficking. Some options include working in law enforcement, advocacy organizations, or even pursuing a career in social work. Each path offers unique opportunities to impact.